The case study I present is the febrile non-hemolytic transfusion reactions, which is one type of transfusion reactions. First of all, let me talk about what is the transfusion reactions. Transfusion reaction is an undesirable response or effect in the patients associated with the administrations of bloods or blood components, which is unwanted reactions occur during or after the transfusions. The transfusions can be divided into two types, acute and delay, and it can further divided into acute immunogenic and acute non-immunogenic, delay immunogenic and delay non-immunogenic. And the transfusion reactions are not always serious. For example, allergic reactions. The physicians or doctor only need to monitor the condition of the patients and no need to give any treatments or the drugs. When the allergic reaction is passed, you can continue the transfusions. But sometimes it can be life-threatening. For example, is the acute hemolytic transfusion reactions, which usually lead to the ABO incompatibility, and usually is caused by the technical error. The major organ was affected by the transfusion reaction usually is the kidney and the lung. Febrile non-hemolytic transfusion reactions is a common transfusion reactions can be observed in the hospital, and it usually occur 1 to 6 hours after the transfusions. The reason that caused the febrile non-hemolytic transfusion reaction is because of the cytokines accumulations during the storage of the cellular components, especially is the platelet units. Why the platelet unit? Because the platelet units only can store for the 7 days, and it was stored in the room temperatures, which lead the cellular component is still activated, and it will produce the cytokines, and the cytokine accumulate in the storage and before transfers into the patients. Beside this one, the febrile non-hemolytic transfusion reaction is also caused by the presence of the recipient's antibody reacting to the donor human's leukocyte antigens. The common symptoms of the febrile non-hemolytic transfusion reaction was increasing the body temperature more than 1 degree Celsius, chill with fever, and the patient was shaking. For this case study, the information I get was from the 47 years old Malay male, and he was suffering from appendicitis. During the pre-transfusion observations by the physicians, the temperatures, respirations, pulse, and blood pressures was normal. For the laboratory testing, the direct home test was negative. ABO grouping, the patients was having blood group B positive, and there is no antibody observed in antibody screenings, and the cross match is compatible, so it is safe to be transfused to the patients. The post-transfusion reaction that observed by the physicians was that the patients start to shaking after 10 minutes of the transfusions, and the temperature increased from 36.9 degrees Celsius to 39 degrees Celsius. The doctor suspect the patients having the transfusion reactions, so the doctor stopped the transfusions and continue give the IV access line opens with the normal saline. The doctor was suspect the patients have the acute hemolysis transfusion reactions, febrile non-hemolytic transfusion reactions, or the bacterial contaminations. just choosing which cannot be identified which type of transfusion reaction was occurred by the patients. So the doctor need to order some laboratory testing, which is the ABO grouping and antibody screening, direct home test, recross matching for the blood pack and the patient sample. Still perform the full blood count, which need to observe the hemoglobins of the patients and lactate dehydrogenases and urine FME, which to prevent the hemolysis of the patients and suspect bacterial contaminations. So the doctor need to send the blood culture, bacterial culture, the blood bottle culture. For blood bottle culture to identify if there is the blood bacteria infections. This is the outcome of the laboratory investigations. For the post-transfusion grouping and antibody screening, which is same as the pre-transfusion grouping and antibody screening, the patient have B positive and no negative in antibody screening. The direct home test was negative and the recross matching was compatible. There is no sign of hemolysis in urine. LDH within the normal range. Full blood count was normal. The blood bottle culture was positive. And gram stent was performed and gram positive cocci was observed. So the doctor investigate the patients suffering from the febrile non-hemolytic transfusion reactions caused by the bacterial contaminations. Why there is no acute hemolysis transfusion reaction? Because the recross matching was compatible and the post-transfusion grouping and antibody screening was same as the pre-transfusion grouping and antibody screening, and the direct home test is negative. So, and there is no hemolysis in the urine. So acute hemolysis transfusion reactions were excluded from the choices. And the blood culture bottle was positive, so identified as the bacterial contaminations. And from the symptoms, there is the symptom of febrile non-hemolytic transfusion reactions. For the discussions, even though we know that the febrile non-hemolytic transfusion reaction is a common transfusion reaction, but it can be several diseases if the doctor didn't notice in time and start the treatments in time. If patient have the febrile non-hemolytic transfusion reaction history, the preventions was suggested to make sure that the patients did not suffering febrile non-hemolytic transfusion reaction again. For pre-storage glucose reduction prevention reactions that occur due to the cytokine accumulation during the storage. And the red cell component prevention technique, including the transfusions of fresh bloods to the patients or wash bloods. For platelet, residual plasma may be removed, and antispirins can be administered prior to the transfusions. In many research, they show that the platelet transfusion reaction have higher chances compared to other blood transfusions. But from the data I obtained, the PEG cell have the highest chances to obtain the febrile non-hemolytic transfusion reactions. Higher chance of platelets had the febrile non-hemolytic transfusion reaction is because of the storage error, and because the platelets was stored in the room temperature, as I mentioned just now, so it will have activated of the blood components, so it will accumulate the cytokine. The febrile non-hemolytic transfusion reactions appear in PEG cell is because the presence of recipients antibody reacting to the donor human blood antigens. So the prevention must be made if the patient have the transfusion reaction history. Okay, thank you.